So, welcome to our health and wellness session, guys. I'm Justin Reynolds. I'm my dad just said. I am your CHP coach. So today we're tackling some hypertension head on. So yeah, get ready for some eye-opening facts and life-changing advice. Listen, all these things look great in how I'm saying it. But funny enough, today is actually going to be kind of special. This is my first time actually introducing myself to you guys. So I'm going to do it a little different. We're going to have another camera coming on in to watch others train and do a demo for you guys. So it's going to be pretty fun. I'm excited. And yeah, so we're going to show you guys how to explore drug-free ways to manage your health rather than, just sticking on drugs. You might be able to work out and do a little bit of things that can help you out. So we're going to go to the next slide real quick. All right, so as you can see, beautiful people on the left-hand side, you're training with things that look like bands. Well, they are bands. I have one right here. Not gonna lie to you, I went like this earlier and a whole lot of things was cracking. So listen, I understand I'm only 32 years old, but I'm old too. My back hurts. I have that thing too. So this is the power of strength training, right? Why does this matter? Well, we have muscle mass, we got bone strength. Then of course we have both together, combining your strength and aerobic exercises. So we're going to talk about a little bit of things like building muscle. Why is it important? Well, it improves blood vessel functions, right? Also, you do look good, but you also feel good, okay? Bone strength. Stronger bones contribute to overall cardiovascular health. And yeah, the power of resistance training. Now, resistance training is this. What I'm going to show you right now, put the camera up a little bit right here, bam. So
Justin, I have a question for the audience.
yes.
There's a little trick to the Zoom technology. Those of you that may not know this, you have a view option. On my computer, it's top right. And the most idealistic view is a side-by-side. That way you can see Justin and the slides, side-by-side speaker. Just a little bit of information. If you're on a device that gives you a view option, you want to go to the side-by-side speaker. Thank you, Justin.
Oh, look at that. Whoa. Appreciate that, Dr. Phil Parks. We're gonna go perfect. I said Dr. Pastor. All right, so we have two different kinds of bags. This one right here is just a handle, right? It has two handles right here. All we're gonna do with this, we probably place it on the ground, step on it, do anything you want. You can do bicep curls, you can do laterals, so on and so forth. The whole point to this is it's very easy to do. You can go ahead and buy these at Target, Dick's Sporting Goods, Walmart, doesn't matter. You could be on a vacation, you could be at home, you could do these things. These simple things that can change a whole lot. Same thing with these bands right here. The exact same thing. They come in different sizes. They could be different weight classes. So it could be like 20 pounds, 30 pounds of resistance, not actual pounds, right? So we can do these for stretching. You can do a whole lot of different things we can do with those. Now, we're gonna go to the next slide. The next slide is gonna be my favorite slide right after that. Let's go on to the next slide. Yeah, perfect. So, aerobic exercises. Now, aerobics, I know, back in the day, you think aerobics is like the dance classes, no, that's not what we're doing today. That is a good thing to do though as well, but walking, jogging, cycling, swimming. Now, let's be real, majority of us, we probably do more walking than we do probably jogging, which is fine, right? We can go on a nice little walk, we can go to the mall, we can wall shop, we can go ahead and look at all the different things we would love to buy, just keep on walking, just keep on walking, don't spend, just keep walking, but at least you're burning something, burning a little bit of calories, and it helps a lot, especially with people with hypertension, high blood pressure. Same thing with jogging, right? Picking up the pace, it's the same thing. Cardiovascular wise, it helps burn calories and it's really good for your overall health. Cycling.
Can I make a comment, Justin?
Here it comes. I knew it was gonna last maybe 4 minutes.
No, I need to comment. Jogging, guys. I have to let you guys know I'm not a big fan of jogging, especially the older we get. What jogging does, it's an impactful thing, right? So it causes what we call micro trauma to your hips, to your lower part of your back, to your knees, to your ankles. It's not very good for you, to be honest about it. So I'm not a big fan of jogging. Never have been, actually. And again, this is a very impactful thing to our bodies as we get older, for sure. So you want to decrease the idea of doing a lot of jogging. For younger people, that is fine. But outside of that, I want to interrupt you, Justin, but yeah, jogging to me is it's not good for people that are certainly over 45, 50 years old. All right.
Oh, I would love to go back and forth with you today. Oh, I have so much to say to that. But swimming is actually a really good positive. I love swimming. For people that do know how to swim, it's actually really good for people who have lower back injuries, knee injuries, stuff like that, is zero gravity. So you can actually focus on rehabilitation. Next slide. The next slide. There we go. All right. So these are the recommendations from the American Hospital Association. Okay. The activity level is moderate intensity aerobics, 150 minutes per week. The vigorous aerobics is 75 minutes per week. It's honestly not as bad as it sounds, right? They put it in minutes. It's not as bad. That's basically like saying that you're just going to either the gym twice a week, or you're doing a nice walk, right, twice a week, and you're doing some jumping jacks or certain little things like that, maybe once or twice a week. Next slide, please. Now, this is one of my favorites. This is not for your average everyday person, but it actually can. A lot of the times when people hear the word high intensity, they kind of get ooh, that's a lot. Not really. So this is high intensity interval training, AKA HIIT, right? We've probably heard this before. If you haven't, welcome aboard. You see the word intense burst, and then you see active recovery, and then repeat. Well, all that means is if I'm doing something intense-wise, whether if it is something that is as simple as a jumping jack, if I'm doing this, right? If I'm here, let's say 20 seconds, right? When I stop, instead of just stopping like this, I'm not active recovering, which means that I'm actually stopping the process of me building strength in my endurance. So what do you do instead? If I'm doing jumping jacks, right here, if I'm getting tired, getting winded, what I do next? Just a little jog, now you're gonna jog. No, someone doesn't like jogging, so just a little running in place, And when you're right back to it, after the 20 seconds is up, we're right back to the jumping jacks. And what does that do? Like I said before, these things are crucial when it comes down to building your endurance, okay? And you can repeat that process 3 or 4 times, okay? And that's for anything, be jumping jacks, be push-ups, whatever it is. But we'll talk about those things later too. Next slide. Oh, this slide I've been waiting for. So we are going to do something a little different today. Today is going to be something that I don't think they've done on the webinar yet. We're going to use demos, but my demo is special because it's my mom. And this also means that you get another version of this. So you're actually, she's stretching now. This is serious. She's stretching. So we have another camera that's going to be coming on in to show you exactly how we're going to be doing this. Okay. So let's get started. Come on now, Mom.
I can't hear anything.
Hear anything? Oh, let me see. Oh, there we go. Can you hear anything now? We're good?
Yes.
Perfect. Okay. So what we're going to do is we're going to start off with some glute bridges. These are things that are really good for your core, especially for the people that are a little bit older. When it comes down to stability and stuff like this, a lot of times people are weak with their hips. These are the kind of workouts that we're going to do to go ahead and get that a little bit better. So, Mom, we're going to lay back down. All we're going to do is you're going to thrust your hips up, so butt up. Perfect. We're going to hold that for 5 seconds. 4, 3, 2. We're going to come back down. Now, I don't want your butt to touch the ground. Right when it's about to touch, you come right back up. Hold it. 5, 4, 3, 2, 1. Right back down. All right, relax. You're going to do that at least 10 times, and then we repeat the process for 4 sets. Okay, so it's 4 sets of 10. These are things that you can do at home. It's really easy. Okay, now we're going to flip it around. What we're going to do next is a plank. She's going right into it. She knew what she was about to do. So we're going to get on her elbows. So on your elbows, perfect. Feet are going to be nice and out. come up. Perfect. Now you see how she's nice and straight in line? That's what we want the most. We don't want an arch. We don't want your butt to be up high. If your butt's too up high, you're gonna hurt your lower back. So this is perfect right here. For beginners, we like to do this for at least 20 seconds, right? For intermediate, a little bit longer. She's probably dying right now, but she's not saying anything. She's a trooper. So we have 5 seconds. 4, 3, 2, and drop. We can drop your knees first. There we go, perfect. And you're good. So now we're gonna get on up. That is a plank. Again, these are things that are gonna help with your core, especially stability. So we're gonna come back up, perfect. Now if you can, we're gonna put the camera right here so you can show her getting on down. This is called a wall sit. Now for wall sits, it's another core exercise. I call these the bandy legs for a reason. So she's gonna go ahead and squat on down. What's nice and perfect is I want her hands to be on the wall, touching the wall, or her hands to be out straight, just like that too. She's gonna hold this. I want you to spread your legs a little bit more. Perfect. Get a little lower. She's gonna feel this one. Not that low. Jesus. She can go low. So we're gonna hold her right there. Normally, you're gonna start seeing trembling of the knees, right? And that's just because at the end of the day, this is a really intense workout for stability, okay? She can hold this for as long as she can because she's been doing this for a long time. So let's just say she does this for 20 seconds. Once she's done, she's gonna get right back up. She's gonna wait at least 15 to 20 seconds and go right back to that same workout. Now that is a wall sit. That's actually a really nice wall sit. Thank you. Now, with that being said, these again are workouts that we can do that are going to be really beneficial for stability, core exercise work, and obviously cardiovascular, because you are going to be getting a nice little sweat at this. Well, this is actually kind of fun that we're doing it like this. I feel like we're at an Apple event. Anyways, thank you for watching. Now I'm going to go right back to this group. All right, cool. So this is what we're going to talk about now, which is the biggest part. Creating your exercise plan. This is really, really, really simple. Hold on. Perfect. Let me see if you can see me now. All right. Can you guys see me? Yes? Perfect. Okay. So what I want to do is I want to go over this just for a little bit. It's just creating your exercise plan. You're assessing your fitness. You're setting realistic goals.
So Justin, you're gonna kill me. You're gonna kill me.
What happened?
You know, I'm the mini dad here. You're mini dad.
No.
But I if you would, before you go, can we get a little Q&A? I know you want to do it at the end, but there's
yeah, absolutely.
Okay. So Dr. Reynolds, I wanted Doc to share. He mentioned about joggers, Justin.
Yes.
And the repercussions of jogging for those of us who are seniors. Anything we just seen, Doc, would you also give the same advice, like give a certain age? Because somebody in the chat says they don't like burpees. I'm almost 60. Burpees is something that I definitely just can't do. Any age sensitive issues of what you just mentioned?
Can I just comment?
What is
on
a burpee?
There, I'll go.
Yeah, yes.
And I'm glad he said that because now he's gonna make me do it. Hey, burpee is great. You know, I didn't know I was gonna be training today. So a burpee is basically this. Move this out of the way. So I know it's hard. When you come down here, we're gonna shoot out, back up, and we're jumping. That's a burpee. Now, here's the thing though. Yes, it is harder for most people that don't really do it that often. But what I would suggest is there is multiple ways of doing a burpee without doing what I just did, right? There are easier ways of doing an actual burpee without doing the jumping and the full extensions or whatever. So what I would suggest, if that's the case, is this. I would come down like as such, come down here, shoot one leg out, one leg out, one leg in, and stand back up. That could be another way to go ahead and do the exact same thing. If that is harder, well, then there is obviously other exercises that we can probably do that can basically promote the exact same amount of cardiovascular.
Awesome. Jumping jacks, are they as detrimental as jogging?
Yeah, y'all make a comment about the burpees first of all. Can everybody hear me or not? Because someone's messing with mine.
Yeah.
All right. Let me say this, guys. First of all, if you're going to do any kind of significant exercise, if you do have a physician, get the clearance from your physician, right? Because there are certain cardiovascular type issues that we may have, whether it's an arrhythmia, whether it's something that's extreme high blood pressure, whatever it is, right? So you want to get that information. If you cannot reach your physician, if you don't have one, then make sure that someone calls at 888-539-4111. That'll get you directly into me personally. And it's recorded. It's on a recorded line of ours. But if you have any questions, the burpee, hey, I wouldn't do no burpee. But hey, I'm 73 years old. The hell am I trying to do a burpee for? You know what I mean? I think Justin will get into some details about things that are really important for seniors, is to make sure that we do not do anything that's going to, but put it this way, we should be doing things that's going to decrease the propensity for us to fall. Falling among elderly people, 65 and over, by the way, guys, and when you get to be 70 plus, is the leading cause of hip fractures because you lose your balance and you fall. So I'm sure that Justin will go over some of these exercises that you can do to increase the strength of your lower back, the core, as we call it, and your thighs, and some balancing exercises, guys, because balancing, as you know, when you get older, very important. You get up into the 80s, then you sure don't want to fall, for sure, right? The bones are brittle. I think Justin mentioned about brittle bones. We call it osteoporosis. Bones are brittle, and any kind of little fall can take you out of here. When I say take you out, I do mean take you out. That means you go to the hospital, you got a broken bone in your 80s, and so on and so forth. You may get what we call a fat emboli, which is a fat that's released from your bone into your blood system, and all of a sudden you're dead, right? So you want to be very, very careful, and to make sure that if you get nothing else from Justin's talk today, webinar today on the exercise and the fitness part of this thing, we want to make sure that we maximize what Justin will be telling us about how can we get and maintain proper balance. Now, yeah, there are certain issues that you can't control. You may have a middle ear problem, right? You may have a balancing problem in general. That's not going to correct that. But what we want to do is that those people that are walking, that are doing pretty good, but they have a tendency to create their own barriers in the house, which they probably did not know that they did not know they had, such as carpets. You may have a rug, right? You may forget to step over the rug. You may have a step or two you have to go down. You may forget, guess what? You know, you may be doing it for a while, but our cognitive function, amen, it does decline somewhat. So you want to make sure that you get some of those obstacles out of the way. And if you can do some of those little small things, such as knowing where your steps are, maybe you have to have your steps lit up like we have at our house. You want to make sure that you're able to see things. You want to get those obstacles out of your way, because those things Jessica cannot teach you and train your muscles and things like that to protect you from falling. So I'm going to appeal to my people that's 70 and over. I'm one of us, just got into the 70 mark. Unfortunately, Dr. Moy's not with us here today, but I'll be seeing him I guess in a couple of days ago. He's celebrating his 70th birthdays. I do not miss people if you guys will have a 70th birthday, let me know, because I want to show up. I want to welcome you to the 70 Club. But when you get in that 70 Club, guys, you think you know it all, right? You think, hey, I do this all the time, but guess what? You're going to be apt to forget about that little rug that someone put there for you to maybe trip and fall. I'm not sure what the situation is at home, okay? But that's a good way to get back at some of us. You may create your own little obstacles, your own little barriers, right? So you want to make sure, again, that all of the barriers that you can potentially become a trap for you. You don't want to trip and fall, because I can tell you one thing. I did it once coming into the house, and it went viral. My son put it on a video, okay? And here I was trying to get into the house. I had a little urgency to do what I had to do. I don't know if Pastor Philip saw this or not, but it went viral. And I got to tell you something, guys. Here I was trying to get into the house real quick, bam! And guess what? It was on our ring, and I said what I had to say, guys. I thought I was going down, but I went down quick and hard. That led to me having a hip issue, and several years later, I ended up having to have a total hip replacement. Okay, so my point is real. You want to make sure that you know where you are at all times within your own house. You want to look, and if you guys got little barriers in the way, especially if you get up at night, a lot of us men get up at night to relieve our bladders or whatever. You want to make sure that you know exactly where you walk. You know, I see Pat Philip, he's smiling a little bit. If brothers on here, I'm sure they're all smiling because we have to.
Hey, Doc, I'm smiling because I've got 3 people. They say they want Justin. They want Justin. They want.
Oh yeah, I figured it. All right. Hey, well, I'm done. I'm out of here.
Okay.
I have told y'all many a times that I knew it was gonna be more than once, twice, 3 times, 4 times. This is gonna happen a lot. But Pastor Philip, to go back to that question that someone asked about the whole burpees thing, I know I was in the middle of kind of talking about the assessing and so on and so forth. That whole thing was actually going to get to the realistic goals, right? The realistic things that you can actually do. The only thing that I would disagree on, and I don't want people to shy away from jogging for a reason. You see, I get it. People who are of older age, for sure, I understand. But the thing that a lot of people don't get is that jogging is a weight-bearing exercise. It can help you build strength into the bones, can lower your risk of osteoporosis. It can lower the risk of broken bones. It's really, really good for mental health. A lot of people, especially people that I know, people that I train, love to jog. And the main reason they love to jog is because it helps with their stress, depression, it can help them improve their sleep, right? I know we love our sleep. And, you know, it's stuff like that. So
recommended canvas, you know, I've been told certain places you shouldn't jog versus, what do you say about that, Justin?
Say it again?
Recommended canvas on the street, grass, tracks.
So honestly, a lot of people like to do nice little runs on treadmills. If you can get to a treadmill, that's great. Your shock absorbers, it's not going to be as bad. Honestly, a lot of people who complain about jogging the most, whether if you're overweight, of course, I would just recommend different shoes. Honestly, certain shoes can go ahead and kind of lessen that shock that you're getting every time. You know, a lot of people sometimes get shin splints, which is very uncomfortable. I've had them a few times. So I wouldn't say street, you know, sidewalks, I guess could be a little fine, but if you could find like a track, maybe that's nice too. But stuff like that, yeah. But to go back onto, if I can go back to the slide, just wanted to before I go back to those questions, I just want to do this one little slide real quick, and then I'll go ahead and go right to the questions, because maybe this might answer a few things. So setting the realistic goal is probably the biggest thing. And I say that because a lot of the times, we dream too big, right? We do. I get a lot of clients that come up to me and they want to, I don't know, they want to look like Idris Elba, or they want and they want to look like me, or I get a female that's over her 50s and wants to look like J-Lo. Like, listen, I can pray so much for you and I can wish for miracles, but that's probably not going to happen. But that's not a bad thing. You can get a realistic goal to be your best self. And that is a thing that I hope people can get out of this, is to find out, to understand that it's not about trying to look like others. It's more about trying to be yourself and get a better version of yourself, right? So to go back onto another thing too, which is assessing your fitness. So the first thing you want to do, my dad was actually correct. You want to go ahead and go to your doctor first before anything. Find out if this is a thing that you can do, that, you know, that allows you to be more healthy. Can I do this? Is this going to be an issue? Do I have a heart issue? So on and so forth. I have a client that I'll show you at the end of all these slides, who was over 300 plus pounds. And his doctor told him, you know, he had everything: hypertension, basic diabetes, everything. He was set for failure. And the first thing his doctor said was, please look for a personal trainer immediately. And if you want to see your kids, and I think people need to have the wants and needs. And I think we need certain things like this to go ahead and allow ourselves to be with our family a little bit longer than we're supposed to be, and so on and so forth. So other than that, we're going to go ahead and go to the next little slide, and we're going to go back to those questions. Perfect. So again, the consistency is key. The consistent part is very interesting though, because a lot of the times my clients that I've ever had an issue with is consistency. I can lead you to the water, but I can't make you drink the water, right? But what I can do is I can be in your ear. So I'm going to be the person who's going to continuously call you and keep you accountable, right? Keep holding you accountable. That's the only thing that people really pay for personal trainers, is to hold them accountable, right? Once that happens, you start to get over that hump, and once you get over that hump, it's smooth sailing, and you're finally going into that right path. Listening to your body, push yourself, but know your limits. Is very true. If you feel like you're doing too much, or you feel like you're hurting that day, your back hurts, whatever it is, your neck hurts, maybe you shouldn't work out that day. Now, I'm sure a lot of people might be looking at me around here because I don't do that. Whenever I'm in pain, I'm still going to the gym. It's a mental thing. I'm trying to work on it, but that's just me. But normally it is true. Listen to your body. Your body's trying to tell you something, or else you can get really hurt. Every step does count. This is the biggest part, and then we can go to questions. This is the biggest part right here. Recognize and celebrate your achievements, no matter how small they are. A lot of people that I have dealt with mentally don't understand that it is that one moment where you can tell yourself and look yourself in the mirror that I'm doing better, I'm doing good. This is, I feel good, right? And when you have that and you can see the little results that you're getting, oh my God, just tell yourself you're doing good, you're doing better. It gives you positive affirmations, and it's gonna want to make you go back to the gym, or make you want to feel that again, to continue on with that. And then seeking support. Yeah, you're not alone. Reach out to friends, family, or professionals like myself for guidance and motivation. And once you get to there, you're pretty much good. Now, Pastor, I know there might be some more questions in there, so we can go ahead and go into that if you'd like.
Yes, sir. You have a couple, and I want to kind of set this up, Dr. Freeman and Justin. You can expound. You and I've had some conversations. So Dr. Freeman's question is, what is the average cost of personal training? Before you answer, I want to kind of give you a space if you're comfortable. Justin and I have been talking about husband-wife special deals because of our partnership with CHP. And Pastor Freeman is a pastor of a church in Pompano. We kind of talked about, Justin, health and wellness ministries, where you visit a church certain times during the week, during the month, whatever. So group. With that being said, question is on you. What is the average cost of personal training?
So that is a very hard answer, and a very hard question. And it's only because it depends on the trainer. It depends on if you ever heard the terminology, you get what you pay for. And you can get a $20 trainer, you can get a $50 trainer, $100 trainer an hour, whatever it is. Me personally, I would say the average I would put my money on would probably be around like $40 to $50 an hour. And that is for the training in itself. Some can say that it's too expensive. And to me, I would say, well, priorities, right? We go, like you were saying earlier, you said something about McDonald's. I heard you say something about McDonald's. We go to McDonald's and we can order certain things, whether it's a Big Mac or whatever. Next thing you know, you're looking at $12, $10, whatever it is, right, for the meal. Get you a McFlurry, right? I'm probably getting everybody hungry right now. But you're doing all these things and you're paying almost $20. You're going on Uber Eats or order whatever it is, and you're looking at $20, $30, whatever it is. And you're ordering nothing but nonsense and junk food. The other things that you do is we can go shopping, we buy things we don't really need, but what we do need is our health. So it really depends on, the real question is, what are you willing to pay for your health, right? If you were to have a dentist, and let's just say you were having your teeth are always clean, but then there's one day, all right, you had to go get a checkup, but you didn't, and you waited and waited and waited. Next thing you know, you got a cavity. Next thing you know, you need a root canal. Well, I don't think you're really going to care about how much it costs. You want that tooth out, right? You're going to do whatever you got to do to go ahead and make sure it gets out. And I think that's the problem. The problem is we wait too long to get a personal trainer rather than doing it before you have the issues. But to answer the question, I think the average cost would be somewhere between $40 and $50 probably an hour.
Can I make a comment? Can I make a comment also, guys? Returns in regards to the payment. One, I think the price is low, but that's good. I like that. The other thing is that if you pay out of your pocket, if you're 65 and over, Medicare will actually reimburse you. It says reimbursable, and I'm pretty sure that that they cover all plans here too. And it's just a matter of doing that. But I think you have to pay out of your pocket first if you're 65 and over. Like I said, and you have Medicare. If you don't have Medicare, then you need to be speaking with one of our CHWs, community health workers, because you should have Medicare. A lot of our people, by the way, they don't have Medicare and they're over 65, some of them are 70. They have no idea what Medicare is, believe it or not. So the point is this. I think Justin will actually show you guys a photo, and I'm sure that Dr. Moise does not mind that. He just joined the 70 Club this week, and you'll see what Dr. Moise looked like before and after. And this is not to build muscle mass for most of us, especially me, right? I just want to be healthy. I want to be strong. I want to decrease the loss of my muscle mass, because every year beyond the age of, I think it's like 65 or 70, no, 65 or so, you lose about 10 to 15% of your muscle mass. Think about that for a minute. So if you continue to lose muscle mass, now all of a sudden the bones will definitely get weak, because your muscles is what makes it possible for you to exercise, right? And like Justin was saying, basically, when you're running or jogging, when you're younger, that works fine, right? But when you get older, I repeat that again, when you get older, it doesn't work too well for you, right? So you want to kind of like moderate this thing. I'm a big fan of treadmills, because it gives you, at least my treadmill has like flexibility. When I walk fast to me, it's like walking 4 miles an hour. It's almost like a light job, but you just really burning it up. You're walking fast. You got that cushion, and I find that my hips, even though I have one replaced, is doing just fine, and I'm doing great with that, guys. So just keep in mind, the cost, I think, is phenomenally low, to be honest about it. However, if you do want to come here or wherever Justin sets things up with you guys at, if that's what you want to do, no one is saying you got to do this thing. That just came up. I guess Dr. Pascal Platt and Justin may have talked about this, because that's, so I did not expect that part of it, but I haven't heard it now. Yeah, it is. If you want to get involved with it, Justin is he's a tough coach, by the way, a tough physical trainer. And talk with anyone that he's trained, and they'll let you know that it's business. So whatever you're paying, you're going to be busting your butt for. You're going to say, at least I would say to myself, damn, why am I paying to get beat up like this? But at the end of the day, it's worth it. I'm out with that.
I think I think someone said it. Is it Lawanta? I hope I'm saying it right. Lawanta Stewart. The cost is an investment in yourself, and that is, yes, 100%. Is exactly what I was saying.
Let Pastor Kara know that Lawanta is a member of the New Bethel Church, and just for the record, just that she's a member, and she is serious. I wish she was in a position to kind of respond, but she may be at work.
No worries, no worries. Well, I know I'm going to do another slide in a second, but for anyone, I know if you can read the chat, if you ever want to go over something, maybe we can come up with something to work out.
One more quick question, Justin. Dr. Bryant talked about what he calls
was it
speed walking. Yes. What is your response to that?
Oh, it's the same thing. I mean, I think anything that can elevate your cardiovascular is great for you. I think I see a lot of speed walking at the mall. I'm not like if you go to any of the malls early in the morning, I only know this because one time I waited for an iPhone, and it was like 7 o'clock in the morning, and there was a lot of people at the mall speed walking throughout the whole entire mall. The mall was basically closed, but people were still doing that. I'm all for it. I have a few clients that also speed walk as well. I'm all for it. It definitely helps with your hips as well, by the way, just saying. There's a movement there that's really nice. What I was gonna say too, by the way, if you have any other questions, or if you are interested in trying to train, listen, whether it's with me or with anybody else, if you need personal training in your life, get it. No one is saying that you need to have it for the next, 10 years, 5 years, 3 years. Maybe you just need it for a couple of months. Maybe you just need it for a few weeks just to get you going in the right direction. That's all. If you take anything from me, just understand that once you start in that good direction, you'll be fine. You can call the office. I think it's 954-368-8784, or you can call me directly or text me directly. My phone number is 954-592-5858. It's my personal phone number. It's out there now. It's out. All right, so we're gonna go back to the slide real quick. I think there was 1 or 2 more left, and then we'll wrap it on up. Oh, the last slide, my main slide, my favorite slide. Okay, so on the left-hand side, this is the guy I was talking about earlier. He's, like I said, he's a client of mine. He's in his 30s. He was 300 plus pounds, and now he's 210. Yes, that is the same person. Yes, he is wearing a Red Sox outfit. He is from Boston. I do not like that, but I had to put it in there regardless.
Boo, boo.
Exactly. That's what I said. Every time I saw him, it was awful. It was hard. And I think that's part of the reason why I trained him so hard was because he was a Boston Red Sox fan. I'm a Yankee fan, so that's why. Yes, he had every issue you can think of. Came to me and we changed his life. It took us 6 months to get to that. 6, yes, 6. It was about 100 pounds. It was a lot. And there was no Ozempic. All right. Back then it was no Ozempic. It was hard work and dedication. Okay. On the right side. Well, this one.
Go Manjaro.
God. This one is the one that I love the most because this man also is in my life and means a lot to me. His name is Dr. Rudy Moise. And you have probably heard from him a few times in these webinars. That is actually him. Yeah, I know. He is 70 years old. Well, 69 still. Turns 70 tomorrow. But I'm putting it at 70 because
he's 70. He's 70.
He's 70. He's 70. He's feeling all of it. Trust me.
He's 70.
Now, my point is when he came to me, he had stubborn fat that wouldn't go away. All right. And he said, Justin, what can I do to relieve all of that and to get all of that out? First thing I said was liposuction. I was kidding. But I said, just come with me. We'll see what we can do. And yeah, we got into the gym, worked out at least 2-3 times a week. And we got him from that left side to that right side. And again, skinny fat is stubborn fat. It really is. And it was a lot of work, but we made it happen. He said he wanted to look really good for his 70th birthday. So he could do a GQ magazine type of a shot or lifestyle. And we did that for him. That's how good he looks today. So anyways, this is what I do. I'm the fitness director over here again. And if you guys do have any more questions or anything like that, please put it in the chat. If not, like I said, call the office at 954-368-8784 or call me or text me directly at 954-592-5858. And yes, I do as well also offer personal training, and I also offer FaceTime training or Zoom call training. So if you can't make it all the way out here, if you live far away, whatever it is, you can always do it online as well. And that is it.
Thank you, Justin, so much. Now, I think we have Dr. Cadilla. She is on. She's ready to do the nutritional part, as well as, of course, the nutritional vitamins, I guess, that people want to get involved in. Because she is a superwoman. She's been on every one of our webinars. She'll be on the one next week. She doesn't know it yet, but she will, because I'll be talking. Whenever I talk, I want her to be with me. Okay. She's a super, like I said, she's a doctor in pharmacy, but I got to tell you something. This woman is awesome. I think you guys will love her. And we'll welcome Dr. Cadilla. Dr. Cadilla, you can explain. First of all, tell us just who you are, Doc. We appreciate that.
Absolutely. So I am Dr. Beatriz Jimenez-Cadilla, and I am a pharmacist that works in a clinic. So I am a non-traditional pharmacist, and I help with managing patients that have diabetes, hypertension, high cholesterol, high blood pressure, high blood sugars. I help manage them under a contract with a doctor, which is called a collaborative practice agreement. And so I start, stop medications, order labs, and help optimize patients on the best therapy based on the other chronic conditions that they have or risk factors for chronic conditions that they may have in the future, so that they live longer and healthier. And today I will be talking about some nutritional components as well as wellness. Let me start sharing my screen. If you can please confirm as soon as you're able to see them. Let's see here real quick. I don't know why it's taking a little bit to load.
Be a presentation here too, doctor, if you want me to bring it up here.
Yes, please. Actually, I think I was able to pull it up.
All right, good.
Let me share my screen in presenter presentation mode. Here we go. Alrighty. The- There you go. Okay. Let me find back the Zoom. There we go. Alrighty. There we go. Can
There you go.
everyone see my slides?
That's him, yes.
Okay, perfect. All right, so I just wanted to take a time to talk about wellness. There are a lot of definitions out there, but this is a topic that's coming out even more as we start thinking of ourselves as more of a whole and not just focusing on specific parts of ourselves, and more like a whole that is impacted by multiple things in the environment and ourselves. So I like to tell my patients that wellness is a journey. It's not a destination. So it is something that we will be constantly, learning about ourselves, improving about ourselves. We'll have our setbacks and then we'll have our successes. So I like this definition. It's from the National Wellness Institute, and it says wellness is an active process through which people become aware of and make choices towards a more successful existence. But this definition can be a little bit controversial because just because you're aware of the choices that help you live a healthier life doesn't mean that you can make those choices. There are environmental factors that can restrict those choices, whether that's food insecurity, financial insecurity, or living in a food desert. So as I mentioned, wellness is not just about weight loss, losing weight. It is not as easy as just completely changing your diet drastically from one day to another. And instead, it is a journey with multiple dimensions, and we have to be self-aware of each of those to make sure that we invest time and effort on them. So they can like complement each other and set you up for small successes that put you in what we call an upward spiral towards healthy living. So I took an image from a publication that's called the Wellness Approach, and it theorizes that we have 8 dimensions of wellness. We have emotional, which is how we feel about ourselves and others. We have financial wellness. We have social wellness, which is how you connect to the community and how supported you feel. Then we have spiritual wellness, and that's your sense of purpose and meaning in life. And then we have occupational, which is how satisfied you are with your work. And we have physical, which is how do you feel your body is in terms of activities, diet, and sleep. Then we have intellectual, which is recognizing your abilities and the areas where you want to grow. And then we have environmental, which is how stimulating is your environment to support that wellness. So I do want to touch base a little bit on obesity. Right now, the United States is impacted by obesity so much because we have 50% of a US population is considered overweight or obese, and that's very, very alarming. It is expected to get worse in the next decade. And so, kind of becoming aware of this now in time can help us take more charge of our health before we start seeing complications of the obesity. So there is a term that they use very often, which is BMI. We'll talk about that. But let's first talk about the definition of obesity based on the World Health Organization. So they defined it as abnormal or excessive fat accumulation that presents as a risk to health. Body mass index is a term that has been used widely to define classifications of obesity, but it shouldn't be used as a sole indicator. And we know there's some limitations now with it, and we'll talk a little bit about it. So obesity, it can be classified from 1 to 5. BMI of 30 to 34.9 is class 1. Class 2, as you see, is 35 to 39. Morbid obesity is a BMI of 40 or more. And then as we go beyond, you can even have a BMI of 60 or more. That's class 5. We are starting to kind of talk a little bit more about not just focusing on the BMI, but also the measuring the waist circumference, because it is more of an accurate picture of a person's health. So this is what we should be kind of targeting, right? In men, it should be 40 inches or less. Waist to hip ratio should be 1.0 or less. In women, the waist to hip ratio should be 0.8 or less. So BMI can be misleading, and so we only use it as a starting point. It is just a rough indicator of how people weight in relation to their height. So there are different interesting facts. One of them is that this BMI measurement actually it was developed about 200 years ago by a mathematician in Belgium that only took into account persons who are white. And so you can suspect it has some limitations, definitely including race. BMI doesn't take into account proportion of body fat, depending on factors like sex and age or race, ethnicity. It can overestimate the risk in Black individuals and underestimate the risk in persons with Asian descent. And then you also can see that a person that has lots of muscle and minimal body fat, they can have the same BMI as a person that has obesity but has less muscle. So you can also have an athlete, probably like Justin, who can have more muscle than fat and have a BMI that is in the overweight range. But we know he's rather healthy. So it is unreliable in certain populations, for example, pregnancy, especially athletes and elderly. So BMI alone can't really depict your overall health status, and we should be focusing on other measurements like I mentioned before. So the American Medical Association suggests that the BMI is used in conjunction with other measures of risk, such as the ones that are listed here. So how much fat you have deep within the abdominal cavity, how much adipose tissue you have on your hip in correlation to your height, what's your body composition, and what is the percentage of fat and bone and muscle, and then other genetic and metabolic factors. I don't know what happened here, but hopefully it goes away.
Can I make one comment, Doc, if you don't mind?
Yeah, go ahead.
Yeah, I want to make sure that everyone that's on, be sure to fill out if you're going to leave early from the actual webinar, be sure that you fill out the post evaluation. I said earlier, that's very important, so make sure that you fill that out. Thank you.
Yeah.
And
All right.
Dr. Cadilla, I know, and I'm so sorry. If you want me to wait, because the BMI piece is a personal challenge I've had. You want to wait to have a little expounding on that, or do you want me to ask now?
Absolutely, go ahead.
So when my wife and I, when our firstborn came, we were always told by the doctors that she was overweight based on the BMI piece, but we intelligently did not know how to receive that. Should we give her more milk, less milk? Can you explain what's a better way of assessing, especially for babies? And African American babies are often told, I don't know if that's the case now, I haven't had a baby in a long time, but back then that they were overweight. And then our grandparents, mothers would tell us, oh, don't worry about what the doctor says. How do you respond to that?
So there are different measurements that they do at the pediatric level. I believe that they have like a percentile too. So based on your kids like weight, but also measurement, it compares it to like 95% of the population. So there are some measurements that pediatric doctors can use to correlate and say that this baby within the normal population. Now, I would have Dr. Reynolds. I think he wanted to mention something else. In terms of pediatric, that there's very limited information out there. I would say for like predicting really the weight and the like the distribution of the body. I think that with close follow-up and management, also of course nutritional education, I think it can help with preventing obesity, especially in younger population. Our Latinos and our black population are definitely more at risk than our general population. Oftentimes they don't have the same access to healthier meals. So close monitoring, especially in those patients that are at high risk, is something that's recommended.
And guys, do keep in mind also that obesity, which is very prevalent, of course, in the African-American community and other people of color community, and it puts us at risk for all different types of things. Yeah, of course, the cardiovascular issue, yes, the diabetes, but also cancer. There's a much higher risk of cancer, specifically prostate and colon cancer, among the Black population that is higher than the general population. The problem also is that we have a much higher risk of death. We call it mortality when you are associated with these different problems. So certainly you want to get the obesity under control. Obesity usually means that you have something else going on anyways, whether you're going to be pre-diabetic, diabetic, you're certainly probably going to be hypertensive. You're going to have hyperlipidemias. That's going to set you up for heart attacks as well as strokes. So there's a lot of things that goes on with obesity. I'll rest. Go ahead. Thank you.
So, it also, there are poor outcomes in Black and American women, so Black, African American, and Latino women that are pregnant. And that is something that the United States has been struggling for decades now. So it's very well known. And so there are still a lot of healthcare disparities that we are still trying to not navigate. But going back to the obesity, the methods that I put here in the previous slides are helpful to kind of assess the BMI in addition to other measurements to kind of have a better understanding of your overall health, especially if you are within those populations that we know are either overestimating or underestimating the risk, right, with the BMI. So these risk factors here, the AMA suggests that you use it in conjunction with the BMI measurement to assess the overall health. So there are some machines that can measure visceral fat. They can tell you what's your body adiposity index, body composition, and then there are some other genetic and metabolic factors that can play into effect. Now, if these machines are used to measure your body composition using like an external like light, we don't know yet the accuracy of these devices into measuring different colors of skin. So that is also a limitation there. And I think that right now we are evolving our definition of obesity. We are recognizing that BMI shouldn't be the only measurement. And I think that in the coming years, we'll get better at targeting, a better definition and incorporating all our minority populations. Also, this measurement here is something that we can use across the different populations. It's something that is started to be talked about. So there is probably going to be in the next couple of years a better assessment depending throughout the different populations, including minority. But those waist to hip ratios are something that you can use also to assess your risk, since you know that you're within that population, that BMI is a limitation measurement for you. So the other thing that I wanted to mention here, so obesity as I said, it's not just environmental factors that are affecting or predisposing you to gain weight and go into obesity and stay in obesity and worsening obesity, but there's also some internal things that are going on. So people with obesity, it has been demonstrated that they have more of the hunger hormone and less of the satiety hormone. So what that means is that people that have obesity are hungrier all the time, and then they overeat before they get the signal of that hormone that tells the body like, hey, stop eating, you're full, get ready for digestion. So it takes them a while or a bigger meal for them to get that signal to stop eating, and so they overeat calories and put them on that vicious circle that's never ending. And then they also have lower taste perception, which means that they don't have a lot of taste with their different types of meals, and so they would want more and more of food so that they can continue to feel the taste that is already a little bit attenuated. And there are other things going on. There's increased resistance to insulin, which means that your body's not going to take in sugars from the blood and move it into where they need to go in the cells so that they can use it for energy. So there are multiple things that are going on in the body that just predispose you even more to stay into that obesity. And that's why exercise kind of helps break that cycle and kind of change that metabolism that's already kind of like setting you up for this. So in terms of lifestyle approaches, it should be person specific. Now with social media out there, there is an overwhelming amount of information, a lot of misinformation, and it's really hard to navigate. I would say every time I'm in social media, I have a guy that tells me, don't drink milk. And then there's another video with a guy telling me, drink milk. And I'm like, what is going on? Then someone's telling me I have to do fasting, intermittent fasting in a supermarket. They're like, you should be doing intermittent fasting. And then the other one's telling, don't do that. So it's very confusing to navigate. And they kind of, in these videos, they kind of try to generalize these diets and approaches to lifestyle when there shouldn't be one, right? It should be personalized. It should be with a personalized trainer, with a personalized nutrition coach that is taking into account your different conditions, your current physical status, your current abilities, so that you set up yourself for success, and you have goals that are specific to you. So this lifestyle approach, it should be personalized to you. There are a lot of diets out there that are very good, but they don't fit everyone. Especially, for example, people that have chronic kidney disease, they shouldn't be on a keto diet. I am sure that you've heard a lot about the keto diet and how people lost weight on it, etc. But keto diet might not be the best option for certain populations, especially if they have chronic kidney disease and their nephrologist told you to stay low on protein. Keto diets are very high in protein. So it is very important to track your diet and have professionals involved in your care that can tell you, okay, these are the different types of diets that may fit your needs based on your comorbidities, and these are the ones that maybe we should be avoiding. Also, there are different types of diet approaches that you do. Are you eating because you want to maintain your weight, or do you want to lose weight? Are you eating because you want to perform? Do you want to do a marathon? So it's always important for you to consider like a wellness coach or a personal trainer or a nutritionist to help navigate the different diet that should be evidence-based, not just whatever Instagram is suggesting you, and that can fit your needs and your chronic conditions.
Can you explain, doctor, what is meant by evidence-based?
Evidence-based is a good question. That's a good question. So evidence-based diets are diets that have had a lot of studies out there have like taken populations and said, okay, let's we're gonna try these specific diets and see if in a prolonged period of time of you dieting this way, it can prevent you from having high blood pressure or having a heart attack or having a stroke. So there are robust studies that are done at a large, like thousands of people. They follow these people for a prolonged period of time, to see if these diets have proven to protect you from having major cardiovascular events, etc. So there are a couple of them out there. One of them is very commonly talked about, especially with the cardiology practice. It's called the dietary approach to stop hypertension. It's called the DASH diet. That has been proven to prevent you from having, high blood pressure, or stop high blood pressure. So not just controlling your sodium, but also consuming an amount of servings of grains and vegetables and fruits and lean meats and nuts, fats and oils and desserts. So that's for DASH diet. And then the Mediterranean diet, which is, of course, we've heard a lot about it, also has had proven to reduce the risk of having diabetes, high cholesterol, dementia, memory loss, depression, high blood pressure. But Mediterranean diet is pretty expensive to maintain, right? And our low income communities, it could be a challenge to follow. But there are other methods out there that can help you follow a healthier lifestyle that doesn't have to be the Mediterranean diet or the DASH diet. So the other one is the plate method. And the plate method is kind of the one that I follow the most because it can adjust to the different food choices that you have throughout the day, depending if you're at work or you're out and about or you're at home. So the plate method is recommended by the CDC. It's basically, it takes your plate and it divides it in four. So in 1/4 of your plate should have a portion of fruit. So, and it tells you the amount of fruits that you should consume. You have another fourth of the plate, which is vegetables. And there it tells you the portion. They always recommend that you use raw over cooked, over like canned, because the raw has the most nutrients in it. As you put it in the freezer or you have it in a container, the container, in order to preserve it, needs salt to prevent from bacteria to grow. And so it'll have some hidden salts in it, versus if you just have it from raw, you have the whole nutrients from it.
Hey,
The
Dr.
other,
Donnelly.
go ahead.
Sorry, Dr. Donnelly, yes. We're getting a lot of questions coming out of the chat room. I'm seeing some of these myself.
Yeah.
I want to ask about, we could probably just begin to wrap up this part of it.
Yeah.
I want you to have some questions and answers, because we do have a number of people that's asking questions specifically about the Ozempic and some other things.
Yes.
The other thing about diet too, guys, is that I'm a believer, big believer of this, is that traditional diets, as we see, that's given through the ADA, American Diabetic Association, the CDC, that is the Center for Disease Control. Those different things, by the way, guys, it doesn't seem to work for us Black folk. They have to understand that we eat certain foods, right? We're going to continue to eat certain foods. What I like to see people talk more to us about is the best way to prepare those foods, to make those foods still delicious, things that we want to eat. You're not going to have Black folk eating a lot of what I would call Anglo-type foods. So we have to make sure that we tailor what we eat based on what we're going to eat. We have to keep it real about that. And then we need to know how to prepare these things. There's certain ways that you have to prepare, let's say, certain meats and certain vegetables, I guess, so on and so forth, right? So my whole point is this: as long as you're going to follow something, obviously, if you decrease the intake, that means you decrease the amount of, and I'd like to say count carbs and not so much calories. Carbs is the main offender for most of us. And I noticed when I went not completely off a carb diet, but I dropped my carbs down to like 50 grams of carbs per day, almost enough to put me into ketosis, right? Carbs is the main thing that's really keeping us. When you take in carbs, the brain, the body the insulin does not deal with that very well. In fact, it turns those carbs into fat. if you just take in calories, maybe you get your calories from 3 things, right? Muscle, proteins, fat, and what's the other one? Protein, fat.
It's protein, fat, grains, and then nutrients from the vegetables, as well as healthy fruits, fresh fruits.
Yeah. So I was going to say is that it's protein, fat, and it's carbs. That's where you get your calories from, right? I'm a big proponent, by the way. I'm not sure if anyone's ever heard about the carnivore diet. Carnivore means that you eat meat, right? And I go back to biblical time and caveman time, basically, right? When people, they ate what they killed. Go back and look at biblical time and look at those characters and look at people. Let's say back 1,000 or so years ago, they're not fat people. They were relatively thin, healthy people. So they say, well, doc, well, if they ate nothing but meat, then why did they die soon? They died soon because most of them had infections. They had no antibiotics for any of that stuff then. None of that stuff, right? So let's put it this way. I went from 265. I did use Manjaro, okay? And I got to a plateau, right, where it just stayed there. Then I say, hey, Dwight, let's do some carnivore thing for a while. Did carnivore for like a month and a half. Nothing but meats. All my numbers went down. Nothing went up, okay? Then I said, well, how about if I just take in fewer carbs? So now I'm on Manjaro, less carbs for sure. Exercise, yes. Maybe 30 minutes about every other day or so, walking, right? And so I went down from those that knew me back then, so to speak, back 2.5 years ago, I weighed 265 pounds, ready to die. Ready to die. When I bent over to tie my shoes, short of breath. Because why is that? Because my stomach was pushing my diaphragm up. Therefore, I had less breathing capacity in my lungs, right? So my point is this, guys. When I lowered those carbs, stayed on my Manjaro, exercised somewhat, now I'm down to 204 pounds. Well, I had got down to 201 after working on that a little bit. But my point is this, guys. No one thing fits all, right? And we want to make sure that we're reaching everyone to make sure that they understand that it's so important to maintain something that we can absolutely maintain. And having a healthy diet is obviously very important. I like the grains, I like the fruits, I like the nuts, I like all the stuff, right? The veggies, all the stuff is good. But it's what you're going to be doing. You're going to decrease what you take in. Put it this way, if you take in fewer calories than what you're going to burn, what's going to happen to you? You're going to lose weight. If you take in more calories than what you burn up, you're going to gain weight. But I'm telling you that the main carbs that I'm most concerned about for our patients of color is going to be carbos. You want to try to get your carbs from maybe protein for sure. Fat doesn't kill you. Fat does not kill you. So in spite of what the science is telling us, there's another whole college out there saying that carnivore diets, and these are not really fad diets. These have been out for quite a while now. And again, like I said, go back to the biblical man, the man back in the day. They didn't have no doggone things to plant and pull them up and eat them. Hell, they had meat. They had animals. And they went out and they killed wild animals, and that's what they ate. They didn't have no nuts per se. They didn't have no dried fruits and all this other good stuff. Okay. They ate what they killed. I rest my case. Go ahead. My wife should show me something. She asked me, do I want Jersey Mike? No, I do not want Jersey Mike.
Dr. Cadilla.
Yes.
Yeah, go ahead.
There's a question, Doc kind of hit a little bit on it. It says, let me slide up here. What do you think about people taking Ozempic for losing weight and they do not have diabetes? Will that help or hurt them in the long run?
Absolutely. That's a really good question. It's a little bit controversial too, so I'm gonna try to make that long answer a little bit short. But
I'm
going
listening.
back, go ahead.
I'm
You're
listening. Go ahead.
So going back to this image right here. So I believe that the science of obesity is it's booming right now. We are kind of exploring the different factors that affect and predispose a person to obesity. I don't think that Ozempic, Wegovy, Zepbound, Mounjaro are just the answer to everything, right? These medications are not just alone are not going to prevent you from all the benefits that the exercise gives you. Cardiovascular benefits, cardiovascular health benefits that exercise gives you. Going a little bit back to what Dr. Reynolds was saying about who we were thousands of years ago when we were nomads out there. We weren't sedentary. We didn't have a farm where we had our chickens and our agriculture growing. We were in a settlement, right? We were nomads, moving miles. We used to walk miles. It was so hard for us to hunt and find meat. Our body is not used to eating meat every day, 2-3 times a day. It was hard for us to find these meats, and then we didn't have a way to preserve these meats, so we had to eat it right there and then, and we had to redistribute it across the community, right? So it was a limited resource back then, and our diet was mainly you know composed of vegetables and fruits, things that you literally pick out of a tree or from the ground. And that is what our body was used to for thousands and thousands of years. And since we started industrializing and settling in the past couple of centuries, our food has become ultra processed, and our body is not used to that. Our body is used to literally grabbing things that come from trees and from the ground, and that is what we should be exposing ourselves to more, and limiting the meat as much as possible. We're supposed to eat fish 3 times a week. That is something that I continue to find challenging, but it is something that our history and our ancestors used to have more access to, compared to large, preys that we used to hunt. So it is not just diet is a big component, but exercise and physical activity is also, it will never be replaceable. Now, do I know that we are already, some things are going on in our body that are already predisposing us to that? Yes, and science is starting to like recognize that. There are some studies now that there's some labs that you can do or will be coming out soon to measure your levels of satiety hormone. So glucagon-like peptides, GLP-1 RAs, Ozempic, Wegovy, Mounjaro and Zepbound are basically like Ozempic on like steroids, because it's even like more powerful because it acts on more receptors in the body. So it has stronger satiety, stronger it prevents you from having cravings in between their meal. So these medications are basically mimicking a hormone that we have naturally in our body, but people with obesity have lower levels of it. So now there's going to be studies probably in the next few years, probably guidelines are going to start recommending that you do these labs tests on people and see if they have chronically low levels of that, and that's what's predisposing them to obesity, because then they do need a supplement, an injection of exogenous, right? Like external hormones that you need to inject into your body to not overeat. So I do see a place in it, but it is not just the end all be all. So one
And I think it's
time
important,
solution to it.
Dr. Cadilla, for our communities to know, and I don't know, Dr. Reynolds may chime in. I have a close family member that takes one of these drugs, but the doctor strongly encouraged them to participate in physical exercise. So we need not think that this is a shortcut from that perspective.
Absolutely. And actually, like this medication, it's not, you can't just go up on the dose indefinitely.
Right.
You should be reaching within a 4 to 6 month period. You're going to reach the highest dose of that medication. So if you just solely depend on the medication to do the work for you, and you just don't make changes on your diet and your exercise, you will plateau and you won't get the best effects and benefits of the medication if you don't put your grain of if you don't, in Spanish we say aportar, if you don't put in your grain to help the medication work. And so that is a big limitation that people kind of don't understand. Then they go into the highest dose and they plateau and they don't lose any weight. They get frustrated, stop the medication, and they'll regain the weight. So we have to apply. And every time this medication gets approved by insurance, the first thing that insurance asks you is, will the patient be using this medication in conjunction with lifestyles, diet, and exercise changes? Are they on a comprehensive program, that nutritional program and physical exercise program that will help get the full benefits of this medication?
Yes, Dr. Reynolds' hand is up for some reason, but no one recognized my hand. But nonetheless, yes, I agree with everything that Dr. Cadilla just said, and I appreciate the question that Pastor Tobat asked a question us on, and that was about the use of the different medications that we use nowadays, whether it's Ozempic, whether it's Wegovy, whether it's Mounjaro, right? And like I said earlier, when I started on Mounjaro, that was 2.5 years ago. Still on it. But guess what, guys? I have my proper physician. I don't have a primary care doctor doing this thing. I have an endocrinologist, okay? And it's so important to make sure that you're being followed properly with these medications. And 100% right, and I think I mentioned earlier in my pretty much testimonial, I guess for me basically, and that is that this medication, you will definitely plateau. I start out at 2.5 of Mounjaro. I've been at 15 milligrams now for the last, I want to say 3 months, plateaued out. But as I exercise more, taking fewer carbs, the weight continues to come down again. So this is something that it's like, it'll get you to a certain goal, certain point, but you have to continue to work. You got to put the work in. That means exercise, drink plenty of water, by the way, too, guys, as well as watching those carbs. Right? If you exercise, you'll probably start burning stuff anyways. But if you take in fewer carbs, trust me, you're going to begin to lose weight anyways. You can do it. You can forget about Mounjaro by itself completely, but just look at your carbs. So when you go to the grocery store to buy your food stuff, check everything for carbs. I like skins, right? You know, pork rind, they call it, right? Guess what pork rind has? How many carbs in pork rind? 0 carbs. So I'm eating a lot of pork rinds, right? Okay, and I'm doing pretty good with that, right? So it's things, grapes. Yeah, grapes have a few more carbs than I want to have, right? But there's certain things, including fruits and vegetables, that you'll find, like for instance, pineapple, loaded with carbs. Boy, I got to take that bromelain that's in the pineapple is good for your heart, good for your blood vessels.
We have people are starting to leave us, and I
know that.
Want you to chime in here. Dr. Cadilla, I'm going to come back to you. Please forgive me. It is so important that you all help us with the post-evaluation survey. 1, 2, thank you to everyone for coming. We do have another webinar on next Saturday. In addition to those of you that are in the Dade County area, we have a health fair event. This month, September, we've had a webinar every week. That won't be the case after September, but we will be having 4 per quarter. Dr. Reynolds, Dr. Cadilla, will you tell us what to expect next week? What are we sharing next week?
Yes, next week we'll be talking about the main monster, that is cardiovascular, dealing with hypertension, heart attacks, strokes, kidney failure, heart failure. And we cannot talk about that enough, because again, it's a very high incidence of these different diseases based on hypertension that leads to the main problems such as strokes. Strokes, of course, lead to disability if you survive a stroke, right? Some cases people don't wish they probably had not even survived a stroke, especially if it's a bleed. We call that a hemorrhage in your brain, right? When that happens, guess what treatment is? We want to get your blood pressure down, but there's nothing that we can do with that unless we can catch it. The neurosurgeon can go in and relieve some of the pressure off your brain, and maybe put a shunt into a part of your brain so you can get some of that pressure off. If not, you're going to most likely die. Fortunately, and I'll keep this short, fortunately for strokes, 85% of all strokes are what we call ischemic strokes. usually caused by a clot or by a plaque, right? Those are strokes that if you get to the ER soon enough, we can most of the time reverse that, okay? But the bottom line of it is that next week, we'll be talking about the same things. I want to see different people on it, but if you did not attend one of those, dealing with hypertension, heart attack, strokes, congestive heart failure, kidney failure, you want to be on this next week. Now, I have Dr. Moyse. I think he'll be sharing the mic with me to speak to our Creole brothers and sisters as well. Dr. Cadilla, she didn't know that. She didn't sign up for this stuff, but she's our resident, our chief pharmacist, doctor of pharmacy, right? So we always have her there, answer questions that doctors are not really trained to answer. And this other thing, guys, one of the most trusted people in the community of medicine are pharmacists. Amen. The pharmacist will give you stuff that doctors don't know, that we're too proud to admit we don't know the answers to. So a good physician has a great relationship with the pharmacist. And I tell you, I always say, bless the pharmacist, because I tell you, we doctors write like this EKG script, but we expect the pharmacist to be able to read that stuff. So when they call us, Dr. Reynolds, can you tell me what you write for? Didn't you get it? Okay, so the bottom line of it is, guys, is that the pharmacist, Dr. Cadilla, she is a very critical link to especially chronic diseases, because every chronic disease has medication associated with it. These medications have complications associated with it as well. Okay, so she will be pretty much on every call that I do, every webinar that I do. And for diabetes, last week she was superb. She's excellent. She's always good. So you'll be stuck with probably she and I for the duration over the next, I guess, have about another 18 or 19 webinars to do. So that's what's going to be going on next week. And then you're right,
Dr. Reynolds, and I say this to the audience, we are working to have the electronic flyer prior to the Sunday prior to the event.
That'll be going out today.
And okay, so check your emails. If you registered, we have your email. I don't know if we are able to do that, but our community health workers, ambassadors will get those. And we want to share that for our worship services on tomorrow. Thank you, Dr. Cadilla. I'm coming back to you.
Really quick. So I know that access to healthy foods is something that we struggle with. I recently noticed that my groceries were very expensive because of inflation, and they were going bad, and I didn't have enough time to be cooking, etc. And then every time I go to the groceries to buy groceries for one meal that I want to do, it's $50 to $70. And I'm like, this is crazy. So I started exploring meal foods that are sent. There's different types. There's like pre-packaged, like already made meals that they sell out there, like Factor X or Factor 5. But there's also HelloFresh, which will send you the ingredients and the recipe and the instructions, and then you can cook it yourself with fresh ingredients. And I've noticed that it is cheaper for me to do these meals with HelloFresh than really to go to the groceries. I buy a portion for 2 people, and some of these meals you can do it in bulk, so you even get more out of the meal than what you usually pay for. So HelloFresh, the cost of it is about $9.99 per meal per person. However, some of these meals, bulk meals that you can do, like lasagna, etc., zucchini lasagna, etc., can be $4 per meal per person. So basically, you spend like $20 or $30 and you have 4 portions, compared to 50 or 70 and you have 4 portions. And you don't have your groceries going bad, and you can pick healthy meals, because that's another thing. You gotta go and like kind of meal prep and come up with your menu for the week, and that's also time consuming. And then so HelloFresh, you can pick what meals you want. It'll tell you how many calories there has, so it does the work kind of for you. And then it has the recipe instructions, and I keep those recipe instructions because then whenever I want to repeat those meals, and I don't want to like pay it again through HelloFresh, I can just go to the supermarket and purchase it myself. If I want to do it in a weekend, etc., where I have more time to do it. So that is an option, especially all of you that live in a food desert. So food deserts are people that don't have a supermarket within a 5 mile radius, especially those that don't have transportation, and so have to take public transportation to go to the groceries and then take a bus with all these grocery bags with you, right? Like that is definitely a limitation. So these meal options, meal service options are things that you can do. Some of them are at a national level, some of them are in a local level too. So based on your zip code, you can also find those prepared meals options. I believe that there is Ideal Nutrition, and there is, I think there's like another one that is in Boca. I live in the Boca area, but you can Google it and compare. I think Ideal Nutrition per meal per person, it's like $7. And you can pick meals that look like your My Plate. You know, they're divided into your grains, your proteins, and your vegetables. So that is an option for people out there. Then there's also applications if you like to cook yourself and you want to track the carbohydrates and your portions, etc. There's fitness apps online if you want to try them. So the MyFitnessPal and the MyPlate are things that you can use for that. And then really quickly for these medications, I did want to, I'll touch on that in a minute. Before we do that, diet, since we're focusing on diet being it has a big impact for people, whether you're taking medications or not, and to complement your diet with exercise. There are continuous glucose monitors out there that can help track how your diet is impacting your blood sugars, whether you have diabetes or not. You don't have to have diabetes to get these continuous glucose monitors. So there are some that are coming out there that don't require a prescription. You literally can go to the pharmacy, grab them from the shelf, and purchase them.
How much
Now,
are those?
this is a luxury right now. They are expensive. So Stello, it just came out and it's about $90. The Lingo, I think, is going to be about $70. So they are still expensive. If you want to get them for cheaper, you might need to get it under the insurance, which is the Dexcom or the Freestyle Libre. And they can help. At least you can wear it for a limited period of time. You don't have to wear it forever. But if you want to kind of be more engaged and see how your diet impacts your blood sugars, you can wear it for a limited period of time. Dr. Reynolds, you were going to say something?
No, not really. But I do want to make a comment about let's say shopping at Publix, quote, in the hood, as opposed to shopping at Publix in the, shall we say, the upscale neighborhoods. You're going to find, guys, what you're going to find on the shelves is totally different. What you're going to find in the other communities that's not of color. You're going to find that what you're going to see as you check, remember I told you guys about the carbs? You're going to find that in our neighborhoods, it's a lot of high carb foods there. I'm not sure who's planning the carb food there for us. They usually charge us even more money, by the way. But these are things that fills us up, right? It cuts your appetite for a minute, and then you're back hungry again. And they're not healthy for you. So if you don't believe me, just like I said, you go to your own neighborhood. If you're like living in an area of middle class, lower middle class Black folk, basically, or in the lower class period, you're going to find out there's a big difference between the cost and the nutritional value of the food stuff that you're getting, as opposed to other communities. I'm done. Doc, you put a slide up?
Yeah. Oh, sorry. I was also going to mention really quickly something about these medications that are out there for weight loss. Right now, Wegovy and Zepbound are the medications that are used for people that don't have diabetes for weight loss. Wegovy is semaglutide. Semaglutide is also Ozempic, which is used for diabetes. Wegovy is used for people that are obese and don't have diabetes. Zepbound is the same as Mounjaro. Mounjaro is used for people with diabetes. Zepbound is used for people that don't have diabetes. Right now, Wegovy is the only medication that has proven to protect you from having a heart attack or a stroke. And people that have obesity and don't have diabetes, based on a published trial from last November. So because of that, Medicare has started to take it into account, take it more seriously, covering this medication. They used to see it as weight loss, as something that's cosmetic or a luxury. They wouldn't cover these medications until that trial on November came out that was included about 6,000 participants. The medication, they were on the medication for about 5 years, and it proved that these people were at lower risk of having a heart attack or a stroke just because of being on the medication, and of course making lifestyle adjustments to diet and exercise. So because of that, Medicare now covers weight loss medications. Listen to me. Medicare covers weight loss medications in people that do not have diabetes, specifically and only for now, Wegovy. What do you have to have so that Medicare covers it? Basically, you would have to about to die, and you didn't die. You survived. Now Medicare is like, oh, sorry. Okay, yeah. Let me cover you this medication, so that you don't actually die a second time. That's the only reason why Medicare would cover you basically now. So you have to have a history already of having a heart attack or a stroke, or have a high coronary calcium score. So if those two didn't happen, ask your doctor to get a coronary calcium score. It'll get approved. Or if you have stents in your heart. So if you have any of these and you don't have diabetes, you are at high risk for having another major cardiovascular episode. And so Wegovy will be covered, but they have to submit a prior authorization, and they have to doctors have to clearly document that on the office visit note for whenever they submit the prior auth. Zepbound right now is not covered by Medicare. Mounjaro is not covered by Medicare. Mounjaro is better than Wegovy because Mounjaro has about a 20% decrease on body weight compared to Wegovy, which can be like 5 to 15. Why is Zepbound not covered by Medicare? Because Zepbound hasn't proven yet that it can protect you from dying. The only one that has proven to do that right now is Wegovy. But there are ongoing trials, of course, and in the coming years, 1 to 2 years, it probably will come out that Zepbound does protect you from having a heart attack or a stroke. That's expected. And when that happens, then Medicare will probably cover it. There's a lot of people out there, lastly, that tell me, oh, I want to start right on the good one, on the best one. I want to start on the Mounjaro. I don't even want to do Wegovy. I want to skip it. I'm going to go straight to Mounjaro. You shouldn't do that. Why? Because once that medication plateaus, that's the maximum benefits that you're going to get. So you shouldn't start with the best one right off the bat. You should try Wegovy first, try to get some weight loss on that, get maximized on it, get into a good routine. And then when you want even more weight loss on, then you escalate it to Zepbound. You have to kind of fail Wegovy, kind of try it to the maximum dose, plateau on it. So then you can escalate the therapy to Zepbound, and you can get additional weight loss benefits of the Zepbound. So there you have weight loss from the Wegovy, and you have weight loss from the Zepbound, versus just going straight to Zepbound and getting all the weight loss from Zepbound, then plateauing and not having any other choice. So that is my opinion. A lot of doctors might not agree with me on that, but a lot of insurances require you first to fail Wegovy to then cover the Zepbound.
Personal question for you, Doc. I've been on, like I said before, certainly on the Mounjaro for 2.5 years now, and it is covered by Medicare, by the way, 65 and older, right? But my question is this: let's say that I want to lose. The wife does not want me to say this, but let's say I want to lose maybe another 10 pounds, and I've already plateaued out because I've been on 15 milligrams of that, which is the highest level, right, of that for the last 6 months. Are you suggesting that Wegovy would be something I may want to try?
No, because you're already on Zepbound, and Zepbound is more powerful than the Wegovy. So when you're switching from therapy, you actually, when you're switching from Wegovy to Zepbound, you are not started on the lowest dose of Zepbound, but you're not started on the highest dose of Zepbound either. You're
Right.
started on like 5 milligrams. That's like the equivalent, the Zepbound dose, 5 milligrams is the equivalent of the maximum dose of Wegovy. So
Right,
you
I
have
got
from 5 to 15
I
to
went from
go up.
I went from 2.5 and it goes away up from there, but in any event.
To 15. So you really can't go, you there's no dose equivalent from Wegovy to switch you
Got
to Zepbound.
Gotcha.
Zepbound is the highest and like surpass the highest doses of Wegovy. So technically, if you switch to Wegovy, 2 milligrams, which is the maximum dose of Wegovy,
Anything.
you're gonna be switching to like Zepbound 5 milligrams, basically.
Got it. All right.
Cadilla, you have a question on what about phentermine? Phentermine?
Good question.
Oh,
So
and
these are the medications that are
Well-
approved for weight loss here. Dr. Reynolds, if you wanted to talk a
Yeah,
little
make-
bit about that. I
let me
don't love
make a comment.
phentermine, but it's an
I
option.
was same thing. Let me make a comment about it, then certainly. And I'm glad that people are still hanging on because this is some really good stuff now, guys. And it seems like always the good stuff come at the very end, right? Penteramine. We used to give that for weight management, along with vitamin B12, which is a natural thing that makes you burn a little bit of a fat, weight, I should say, or carbs. However, penteramine is something that can be, I would almost call it addictive, and that there's a need to want to have it. The other thing is that if you have blood pressure issues, or if you have a arrhythmia, let's say you have a cardiovascular issue at all, you should not be on penteramine. Period. It's a stimulant. Okay. Coffee with this, it may kill you also. I'm not a big fan of it. Certainly, I know other people are still doing it, using it, that are physicians that are in weight loss clinics. But this would be the farthest thing that I want to keep away from you guys in terms of trying to put you on some medications to try to help you manage your weight situation. And penteramine is certainly, that's when I think it's 30 milligrams of it daily. You take it early in the morning, I think, before you have your first meal or whatever it is. And if you survive the first 3 or 4 weeks, you probably will be okay. Bottom line of it is that it has to be constantly monitored, especially your blood pressure, because your blood pressure does have an uptick in that, and so does your pulse rate. So, Doc, I'll let you go ahead and make comments beyond that.
Yeah, so out of all the medications that are out there for weight loss, a lot of them have nasty side effects. I think Wegovy and Zepbound are kind of like the safest out of our options here. The other ones that are safe too would be Contrave. That's just my opinion. Everyone can differ, but Contrave is naltrexone and bupropion.
Yeah.
So these agents are used separately for mental health disorders. Naltrexone can be used for like substance abuse. So people that have cravings for addictive substances like alcohol and opioids. You use naltrexone to kind of go target on the brain to stop the cravings. And that mechanism is very similar for people with obesity that have cravings. So that is kind of like the mechanism behind it. And Contrave has similar effectiveness to Wegovy in terms of how much weight loss you get from the medication. Bupropion is an antidepressant. And it is also used for people, especially if you're like depressed and you use tobacco. We use bupropion because it also works with those like cravings, and it also gives you it decreases your appetite too. So when you use those two medications together, you have a good significant weight loss that's comparable to Wegovy. So I've seen in the VA and several practices that they are prescribing, not Contrave brand name, they're prescribing the separate components of it separately by separate tablets. So naltrexone and bupropion. And then they make the Contrave basically, but the Contrave is 2 medications on one. But it's super expensive and a lot of insurances don't cover it. But naltrexone by itself as a pill is super cheap. Bupropion is super cheap too by itself. So you can use it for weight loss whenever the Wegovy is not being covered. But they still have side effects. They shouldn't be used in people that have substance abuse, because if they have relapse, there can be issues. It also can increase a little bit your heart rate. So there are some, it can also lower your seizure threshold. We can keep on talking about side effects of these. Versus Wegovy and Zepbound, they are generally safer because Wegovy mimics the hormone that we naturally have in our body. And actually, interestingly enough, Wegovy is 97% almost, the molecule is 97% almost identical to the one that we have in our body. So that's why it's like very specific and very targeted. And since it's mimicking very much the hormone that we produce naturally ourselves, our body is sensitive to it. So with the Wegovy and the Zepbound, we shouldn't be using it in people that have a history of pancreatitis, and we shouldn't be using it in people that have a history of like gallbladder issues, and cholecystitis. And then it shouldn't be used in people that have a history of a rare cancer, a thyroid cancer that's called HCC, hepatocellular carcinoma. And it's a specific type of thyroid cancer. I don't think it's hepatocellular carcinoma. I'm gonna get back
So
to you.
Dr. Cadilla, Dr. Reynolds, they tell the preacher that we cannot preach the whole Bible in one Sunday.
Amen to that. Rome was not built in one day, not a week, not a year, but several years. So this is a process. And I want to thank everyone for attending this particular webinar. And I'll let Pastor Carol, I'd like for you to close it out with prayer, if you don't mind, sir.
Yes, sir. Most gracious God, thank you for this day that you've given us, this time, this information that is life-giving, life-saving. We pray now for blessings upon our presenters. We thank you for the leadership of this organization. We thank you for all those who are listening in, and we pray that we were made better and that we were impacted in a great way, that we take this information, apply it to our lives, and then share it with others so that we can be well. This is our prayer, we pray in thy Son's Jesus' name. Amen.